Health and Family Welfare and the Karnataka State AIDS Prevention Society had officially denied media reports claiming that 7,000 college students in the state have tested HIV positive and that HIV testing has been made mandatory in colleges. In an official press release issued on July 29, 2026, the project director of the Karnataka State AIDS Prevention Society sent a clarification to the Karnataka Press Club, Cubbon Park, Bengaluru, stating that the widely circulated report is false and based on a complete misinterpretation of official data. According to the Health Department, the state has launched the Mobilisation for AIDS Suraksha program to prevent the spread of HIV and create awareness about HIV/AIDS among college students. As part of this initiative, an 8-month Red Ribbon awareness campaign is being conducted, under which various awareness activities are being organized every month across educational institutions. The press release explained that, according to estimates by the National AIDS Control Organization, nearly 56,000 people in Karnataka are living with HIV but have not yet been identified. To help identify these individuals, the government has advised the public to scan the breakfreeindia.org HIV self-risk assessment QR code to assess their HIV risk. Those found to be at risk are encouraged to voluntarily undergo an HIV test. The government has also instructed various departments to promote HIV awareness through the QR code and organize integrated health camps in coordination with the district AIDS Prevention and Control Officer. The clarification further stated that 39,028 HIV positive individuals aged between 18 to 35 years have been receiving antiretroviral therapy since 2004. However, some media organizations wrongly interpreted this figure and reported that 7,000 college students are HIV positive, a claim the department said is completely incorrect. The Health Department also clarified that under the HIV and AIDS Prevention and Control Act 2017, HIV testing cannot be made compulsory for any individual. Therefore, the state government has not made HIV testing mandatory in Karnataka colleges or anywhere else in the state. Officials added that officers scanning the QR code, users can complete a self-risk assessment and the application will provide information about the nearest integrated counseling and testing center where they can undergo a confirmatory HIV test if required. The press release also highlighted that Karnataka has launched a mascot campaign while advertisements are being displayed on dating apps to spread HIV awareness, particularly among high-risk groups. Concluding the clarification, the Karnataka State AIDS Prevention Society appealed to all newspapers and news organizations to publish the official clarification in place of the incorrect report to prevent the spread of misinformation among the public. So viewers, what's your take on this? Share your thoughts in the comment section. For more such updates, stay tuned to Daily Salar Digital.